Today we're talking about obsessive compulsive disorder, or OCD. OCD affects millions of people worldwide, and while it's often misunderstood, there are ways to better understand the symptoms and manage intrusive thoughts effectively. OCD is a mental health condition. It is characterized by two key components: obsessions and compulsions. Obsessions are persistent, unwanted thoughts, images, or urges that cause anxiety. Compulsions are repetitive behaviors or mental acts performed to try to relieve that anxiety. For example, someone might obsess over germs and feel the urge to wash their hands repeatedly, even when it's unnecessary. It's important to remember that OCD isn't just about being neat or organized. It's a serious condition that can impact daily life. Now let's explore some common symptoms. OCD symptoms can vary, but they often include obsessions such as fear of contamination or germs, intrusive thoughts about harm, violence, or taboo subjects, extreme need for symmetry or order, compulsions such as excessive hand washing or cleaning, checking things repeatedly, like locks or appliances, counting, tapping, or repeating words silently. If you're experiencing symptoms like these, you're not alone. Let's talk about how to address intrusive thoughts and reduce their impact. Intrusive thoughts are a hallmark of OCD, and they can be distressing. But here are some strategies to help manage them. Acknowledge the thoughts. Recognize that intrusive thoughts are just thoughts. They don't define you, and they don't mean you'll act on them. Name the thought. Now think of the thought that keeps coming up for you. Instead of getting caught in it, try to observe it. Imagine holding it in your hand or seeing it float by like a cloud. Say to yourself, I notice I am having the thought that, and then name the thought. For example, I notice I'm having the thought that I'm not good enough, or I notice I'm having the thought that I'll never finish this task. Naming the thought helps you step back and see it for what it is, just a thought. Reframe with curiosity. Now ask yourself, is this thought helpful right now? Most obsessive thoughts aren't. They often exaggerate or focus on worst-case scenarios. Instead, try reframing. Ask, what's a kinder, more balanced perspective I can take here? For example, if your thought is, I'll never get this right, you might reframe it as, it's okay to take things one step at a time. Or if your thought is, I'm not enough, try I'm doing my best and that's enough for now. Practice mindfulness. Techniques like deep breathing or grounding exercises can help you stay present and reduce anxiety. Avoid compulsions. Resist the urge to engage in compulsive behaviors, even though it's tough. This helps break the cycle of OCD over time. Challenge the thoughts. Cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP, is a proven treatment. Working with a therapist, you can learn to face your fears without performing compulsions. Please seek professional help. A mental health professional can provide a diagnosis and recommend therapies or medications to help. Remember, managing OCD takes time, patience, and support. It's okay to reach out for help. You don't have to do this alone. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more mental health content. Share your thoughts or experiences in the comments. Your story could help someone else. Take care of yourself and remember, you're stronger than you think. See you next time.